As holiday season approaches, viewers, videos of bodies piling up at hospitals in China have once again sent chills down the spine of a world that is still reeling from the trauma of a debilitating Delta-driven COVID wave. You will remember that wave, viewers. It was horrific. Today, those scenes are being played out. Where? In China. Horrific scenes and predictions are emerging from there. An epidemiologist has projected that 60% of the country's population could end up getting infected over the course of the next few months. Another report suggests that it is running the risk of around 2 million deaths by the end of next year. Figures and pictures that have set alarm bells ringing even here in India, forcing authorities to take stock. And today, the Union Health Minister chaired a high-level meeting with key stakeholders, and while assuring one and all that there is no need to panic and India is prepared for any exigency, any situation, also directed all concerned to strengthen surveillance and vaccination coverage. Now, from random screaming of international passengers at the airports to ramping up testing and making genome sequencing mandatory for all cases testing positive, centers ensuring the shield against COVID is foolproof. But with only 27% of people having received the booster dose so far, questions are now being raised about whether India is prepared to tackle any impending crisis. And I want to straight away, viewers, without delay, go across to Mr. Randeep Guleria, Dr. Randeep Guleria, former AIIMS director. He used to be with us pretty much on a daily basis during the last wave, and lovely to see you, sir, looking healthy.
Thank you.
And looking, I hope, optimistic tonight. So I'm going to ask you a couple of questions. Many are already saying that we perhaps have woken up a little late, that when this scary picture was emerging a week ago in China, we should have perhaps even cut our ties, as in travel, etc., between India and China, or come out with other restrictions. First of all, have we reacted too late? Because I know that B.7 or some such variant that is sort of coursing through the Chinese, at least 4 or 5 cases have been detected here in India. So number one, sir, should we have taken that measure earlier? Number two, can we escape this particular variant? If not, why?
So thank you for having me over. First of all, the B.7 variant had been reported in India even in October, and it was being observed very closely. And as we can see, we haven't seen a surge in the number of cases in our country, despite the B.7 being there. Okay. And we've also not seen increased hospitalization or deaths. As a matter of fact, our numbers are probably the lowest that we've seen since the beginning of the pandemic in 2020. And the reason for that is, I think, that our situation is very different from what we are seeing in China. Firstly, as far as India is concerned, we have a very robust and vaccine policy. At least a large number of people have got the 2 doses. The booster dose, still we need to push for getting more and more people to take the booster dose. And a large number of people have had natural infection, and therefore there is good amount of immunity in our population. And therefore, although we may see more cases, we will not see severe cases, hospitalization or deaths. China, on the other hand, had a zero COVID policy, where a large number of its zero COVID, the virus has not run through the population and caused the natural immunity that we have had over the last few years or last few months. Secondly, the vaccine efficacy, as far as the locally made Chinese vaccine is concerned, is still a big debate, especially against the new variants. There is a lot of data that has emerged from our country regarding the efficacy of our vaccine even against Omicron. But that data is not available as far as China is concerned. And therefore, both these factors, a population which has not been exposed to the virus through natural means, a vaccine which is not effective, and the lifting of the zero COVID policy, thereby exposing a large number of people to the new variant, is causing the virus to run through their country. And a large number of the elderly and high-risk group have not even got themselves vaccinated. The rates are very low. All of this is contributing to what we're seeing in China. But I don't think that we're seeing such a situation in India. Like I said, the variant has already been there, but we need to be vigilant. I think we need to push for people to come out and get their booster dose if it's due. We need to ramp up our testing, especially more and more people should come forward and get themselves tested. Many people who have flu-like illness don't come forward and get themselves tested, or just do a rapid antigen test and therefore we are not able to do genome sequencing, and we are not able to pick up any new variants if they emerge. So I think we need to be vigilant, be more careful in terms of monitoring, but I don't think there's a need to panic.
Very quickly, should masking be reintroduced? Testing, you've already said, is now essential. People who suspect that they have a cold, etc., must definitely go straight off and get themselves tested so that we know what there is. But masking, number one. Number two, should we decrease travel between India and China, bring in certain measures or better screening at the airports, mandatory screening perhaps of people coming in from China and quarantine? Do stricter measures need to be taken? And number three, sir, a large number of people in India have taken also the booster. What is the booster's efficacy over a period of time? And do we need now a fourth booster to be taken or a second booster to be taken?
So as far as masking is concerned, I think we should encourage more and more people, especially those who are at higher risk and who are having comorbidities, to get themselves wear a mask.
Okay.
It will not only protect you against COVID, it will protect you against other viral infections, including influenza. And in places like Delhi, it will also protect you against air pollution. Right. So I think masking is something which is useful, and we should encourage people to do that. It may not work if we really force it, because we haven't been able to do that. It's important to really increase public awareness and be able to push for masking.
Right.
As far as flights are concerned, I think we are doing random testing at the airport for people who are coming from abroad. But banning flights is going to be very difficult because of various hubs that exist. People now go to different areas and then have a transit and come to India. So it's a big challenge to really be able to do that, and we found that very difficult in the past. I would actually say that we should encourage individuals who come from outside and develop flu-like symptoms to come forward and get themselves tested, especially the RT-PCR testing, and if they are positive, genome sequencing should be done. People should consider this as a responsibility so that we can pick up new variants rather than doing
very
that.
Quickly,
because remember,
on the point of booster, some people have had one booster. Is it time for another? What is the periodicity of that?
So I think over a period of time, we will need to have regular boosters. We must also develop to show that the booster is effective against the new variants. What has happened in the US and the European Union is that now they have a booster which is a bivalent booster, which covers both the Omicron strain and the older Wuhan strain. So gradually we will need to develop a booster which covers the newer strains which are emerging, so that it protects against the newer strain, and that is what will happen over a period of time.
Well, thank you, Dr. Guleria. Thank you very much for speaking to us. I want to open this up very quickly. I want to bring in Dr. Ranganathan also, as well as Dr. Bagai. Dr. Bagai, very quickly, how well prepared are we?
Good evening, Rahul. Good evening, everyone. I think India is extremely well prepared. Both the vaccines, which are the adenovector-based vaccines, have stood the test of time. They have an efficacy to prevent serious infection, death, and ICU admissions nearing 90%, even against the BA.4, BA.5, which are the sublineages of BA.2. I think our protocols are in place. The preparedness is there. The China story is extremely different and hugely variant as far as India is concerned. They had, to begin with, a substandard vaccine. I don't know why it came into the market to begin with. With the Omicron, there's a multicentric data crunching meta-analysis of 68 randomized controlled trials, which has shown the efficacy of this against the Omicron, especially BA.7, to dip below 20%. It's a largely unexposed population which has no cross-reactive immunity. That means even against the other infections, not only the COVID infections or the Omicron. So even influenza gives cross-reactivity, common cold gives cross-reactivity. And it's a very poorly penetrated vaccine campaign there, which didn't work, poor platform. So I think we need to be prepared. Okay. It's a mode of preparedness for the Indian citizen, that avoid very, very large crowded places. If possible, please wear a mask. I would stress on the fact that your booster, third dose is important. There is again enough data in the international sphere that there is not much benefit from the fourth dose. That means there's not much benefit from the second and the first booster. So one booster is more than enough. And if possible, India must try to get the bivalent dose, which will become the possible booster going forward.
Very important. Now, let me quickly bring in Dr. Ranganathan and GVL Narasimha Rao and Tehseen Poonawala, though Tehseen is not a doctor, but nonetheless, neither is the BJP MP. But there is another element to this story. Now, Dr. Ranganathan, Dr. Guleria stressed upon how people must be mindful and behave responsibly in different capacities. And this was also emphasized by the health minister today, Mr. Mandavia. He called upon, for example, politicians to ensure against if they are holding massive rallies, then there should be precautions taken, testing, etc. must be done. We've just had a scare in the Bharat Jodo Yatra where the Himachal CM tested positive right after attending that and also went into the assembly. Many people, however, are seeing this as a largely political attack. And they're saying that Mandavia is picking the wrong example, deliberately picking on Rahul Gandhi, etc., because, the government is scared of the Bharat Jodo Yatra, this, that, the other. But where do you see this? Do you see this a trivialization of the discourse both ways? Or do you believe that this is sound advice which must be taken?
No, Rahul, look, I've always believed never mix politics with science, because then all you would end up with is political science. So the health minister is absolutely right. We must take these precautions and they must be taken immediately. But I have three things to say. I really am very thankful to Dr. Guleria and Dr. Bagai. They've really summed up the whole situation vis-a-vis China very succinctly. And I think it was very important for the viewers to understand that the situation that the Chinese people are facing is just not the same as what the Indians might face. Because the Chinese vaccine honestly did not work. China had a zero COVID policy, and suddenly when they lifted it, it was like the floodgates opened. Secondly, and here I have to say this, maybe disagree a little with Dr. Guleria, because NIV ICMR study itself has said that the vaccines very much were pretty useless against Omicron. They were quite efficacious against Delta, less so than the first one. So the booster, as Dr. Bagai said, does make a big difference. I think people who haven't got their boosters done, or maybe got their boosters a year ago, it's probably a good idea to have the boosters done. The government must, and Mr. Rao must formulate a policy to come forward and say that those people, especially the elderly and the vulnerable, should get booster doses. I think it's important. Secondly, the neutralizing capability might not be there, but the T-cell immunity boosting definitely is there because of the vaccines. But here I ask a question that hopefully the politicians would take it further to the scientific experts, because if you remember, the vaccines that we are using right now are more than actually 2.5, 3 years old.
Yes.
So why have we not formulated any new vaccine? Remember, the original strain, the vaccine which are of the original strain, took 6 months to formulate and then be administered to the whole population. That was January 1st, 2021, if I'm not mistaken, that they started getting administered. Yeah. It's been almost 2 years now.
Yes.
Where are the new vaccines?
Where are the new vaccines?
If we had a vaccine against Omicron, if we had a vaccine against the new BF,
Let me get Mr. GVL Narasimha Rao in. Sir, Mr. Mandavia, of course, taking on Rahul Gandhi, saying, wrap up the Bharat Jodo if you can't take precautions. Sort of emphasizing the wrong stuff right now. Should we not be bothering about getting ourselves the latest vaccines which cover for the new variants, rather than bothering about what Rahul Gandhi is doing and, what his beard looks like, etc., etc.? Just simple, straightforward question.
No, I think these two, there is no contradiction between the two. The advice that Honorable Minister has given as a kind of an advice applies to everyone.
Yeah, but he didn't address everybody. He addressed Rahul Gandhi. He didn't tell that to the BJP. He didn't tell that to the BJP cadre. He didn't tell that to others who are, so I'm just saying, it was a selective intervention. Let's be honest about it. It was selective, so you made a bit of a political, you mixed in political.
Because it's a...
Yeah. Go ahead.
No, no. I disagree with you on this because there is no political capital to be made out of this.
Oh, really?
It's only a sort of a forewarning. There are some, like you mentioned, the Chief Minister of Himachal already got the virus after attending the meeting.
Yeah.
So it's a word of
why didn't he say that? Why didn't he say that to all the parliamentarians today?
The ministry.
No, why didn't he say that about all the parliamentarians today who were sitting in a house without any masking or social distancing? Yesterday there was a lunch that was held, millet lunch it was called. Even the Prime Minister was there.
Yeah, the advice, yes, Rahul, the advice was to large crowds gathering.
Right.
We are not a large crowd of people in
Sir,
Parliament,
we
but
locked
still,
up.
I think
Sir,
your point is well taken.
We took umbrage.
Everyone should.
Sir, you know, last time, you remember, there was masking and all sorts of things that were done in Parliament also. Now, you know, we can today choose to disagree, but we know that it was a political intervention. All I'm asking, sir, are we focusing again on the wrong things? We can embarrass the opposition. You want to, you can do it. But let me just come back to the question that Dr. Ranganathan posed. Are we focusing on that? Will you carry that message back?
No, obviously, you see, the government came up with a set of guidelines.
Yeah.
And in the course of next few days, because we have Christmas coming up, the New Year, which will certainly see large gatherings, large mass of people gathering in different cities. Although we don't have a reason to panic, we need to be extra cautious. Also, we need to push
be cautious, but the government must also be extremely inclusive in its signaling. There was a Jan Akrosh rally in Rajasthan undertaken by the BJP. It's not as if the health minister sent a notice to the Rajasthan BJP president saying be vigilant. So viewers, let's not mix politics, as Dr. Ranganathan said, with science, because we'll end up with political science, though that is also a science in its own way. But nonetheless, it's not meant to be an exact science. But viewers, we've got to rise above politics this round. The opposition has to be less negative, and the ruling dispensation has to be less selective. Let's hope we can forge common ground. I leave it at that. Let's focus on the right issues. Here on Times Now, we will be asking the right questions on your behalf.